Rule number 3. I shouldn't call them rules, should I? Suggestions, subtle suggestions. I call this one make magic movies. I like the word magic because there's a lot of magic in our world that we take for granted. And I make movies because we can all be our own movie director. And I use the word make because we're in control. We can make whatever movies we want in our head. It's only limited by our imagination. Now, when I'm talking to self-development people, we call this, entering into hypnotic states or trance states. When I'm talking to sports people, they're not interested in that kind of mumbo-jumbo. I say we're practicing visualization exercises. And when I'm with distinguished corporate people like yourselves, business leaders of the present and definitely the future, I say, this next bit is about strategic planning. But it's a closed-eye strategic planning session. Now, I've got an exercise that we're going to do as a group. But first of all, I have to load you with some information. I want you to put your books and things on the floor. And obviously sit comfortably. Don't cross your legs. That interferes with the chakras and the chai and blood and who knows what else. What else do I want you to do? I want Graham to play some nice music if you have some by any chance, Graham. And I want you to hold your hands roughly in front of you like I'm holding now. And again, they've got to be comfortable because you're going to be in this posture for about 3 minutes. Okay, Michelle, can you do this one? Yeah, you got it. You got it. So we've all got our hands like that? Okay. Now you can close your eyes. And all I want you to think about right now is absolutely nothing. But of course, our brains aren't made like that. It's impossible to think of nothing. But if we can't think of nothing, we can control what we do want to think about. And I'm going to paint a little picture for you now. And of course, 40% of your brain, in one way or another, is connected with pictures and visualization. A friend has asked you to take her to the hospital. She has to collect a result or something simple like that. She hasn't got a car. So you say, yes, of course. So you drive her to hospital, you park the car, and you sit yourself quietly down in outpatient's department while your friend goes away to collect her blood result or whatever it might be. And you've only been there about 5 minutes. And already you're starting to get a bit bored. And you're looking around. And then you see a nurse walking towards you. And she's carrying something. It's too far away to see what it is. But as she gets closer, you see that she's carrying a blanket. And inside the blanket is a baby. And you can tell from looking at the baby that it's only just been born. And she comes to you and says, please will you help me? I just want you to hold this baby for a moment. And she places the baby in your hand. And she says, thank you. I'll be back very shortly. The baby is fine and healthy. Just look after it carefully. Hold it gently, but also firmly enough so that baby doesn't fall on the floor. And the final thing she says as she's walking away, she looks over her shoulder. She said, when babies are born, they're very cold. I want you to hold this baby and I want you to keep the baby warm. And using your imagination and your visualization, I want you to keep that baby warm right now. I want you to feel the warmth in your hands, transmitting through the blanket to the baby. And just feel what it feels like. Feel what that warmth feels like. Feel what the baby feels like. And if you want to move your hands in a different position, you can do that as well. Whatever is going to keep baby warm. Okay, now I want you to come back to the room now. Keep your eyes closed, keep holding on to baby. But now be more aware of the noises that you can hear inside this room. That's one way of staying in the present. Thinking how many different noises you can hear. And then when you're ready, just open your eyes. Open your eyes whenever you're ready now. and rest your hands. Because the nurse has come and she's taken the baby and she says, thank you very much. You kept my baby very warm. You did a great job. Well, that's a visualization exercise. And the reason I do it is just to give you an example of the pictures that your mind can create. Now, I'd like, again, some of you to just say, how did that work for you? What kind of things were you aware of during that little exercise we did? This closed-eye strategic planning that I will link back to business shortly. Any observations?
Yeah, I can feel the size of the baby, I can feel the warmth, I can feel the baby's skin.
Barry, the size of the baby, the warmth of the baby, you could feel the baby's skin. Yeah. Anything else?
I visualised the same hospital that I always go to, and it was like memories from my past, so the pictures sitting there waiting.
Yeah. So you weaved a movie into another movie, which of course is what the brain is doing all the time. Yeah. Anything else?